Have you ever looked at a medicated dressing and wondered what's actually in it? Well, today we're doing a quick rundown of the Polygras antimicrobial dressing. We're going to stick to the official product info to see what it is, how it works, and most importantly, when you should and shouldn't be using it. Let's dive in. So we're going to break this down into 5 quick parts. First, what exactly is Polygras? Then we'll get into the right situations to use it. After that, we'll cover some super important safety precautions. We'll also look at when to avoid it completely, and we'll wrap up with how to store it properly so it's ready when you need it. All right, let's start with the basics. Section 1, what is Polygras? When you pull this dressing out of the package, what are you actually looking at? Let's break down its core components. Okay, so at its heart, it's a sterile gauze, but this isn't your everyday gauze. It's a special kind called leno gauze, and the key thing here is that it's soaked or impregnated with a really specific combo of ingredients. Let's see what each of those ingredients actually does. And here's where it all comes together. It's kind of like a 3-part system. First, you've got the leno gauze itself, which is just a good absorbent base. Then you've got the paraffin. This is huge because it creates a non-stick layer. That means when you change the dressing, it doesn't rip off healing skin, way less painful. And finally, you get this antibiotic 1-2 punch from Polymyxin B and Bacitracin Zinc. They work together to fight off bacteria right at the wound site. So now we know it's this non-stick, bacteria-fighting dressing. The next logical question is, where does it really shine? Let's look at the official list of recommended uses. You can see it's really designed for any wound where you're worried about infection. We're talking about things like minor burns, cuts, and scrapes, but it's also built for more serious situations like protecting skin graft sites or helping to manage a leg ulcers. For those kinds of wounds, keeping infection out isn't just a nice-to-have, it's absolutely critical for healing. Okay, we know what it is and when to use it. Now for a topic that's just as important: safety. When you're using this dressing, there are a couple of key things you absolutely need to keep an eye on. So, while this dressing is doing its job fighting bacteria, are there any potential downsides or risks to watch for? Yes, there are, and it's really important to know what they are for safe and effective use. Now, this is a really important point for any antibiotic product, not just this one. If you use it for too long, you can knock down all the bacteria, which can sometimes create an opening for other things, like fungi, to move in and take over. So the takeaway here is that it's meant for short-term wound management, not for continuous long-term use. And you've got to pay close attention to this one. Hypersensitivity reaction is really just the technical term for an allergic reaction. If you apply the dressing and then notice things like increased redness, new swelling, or itching around the area, that's a big red flag. The instruction is clear. Take it off right away and get in touch with a doctor. All right, so we just talked about things to monitor. Now let's talk about situations where you shouldn't use this dressing at all. These are the contraindications, and it's basically knowing when Polygras just isn't the right tool for the job. And this slide lays out that difference perfectly. On the left, precautions are what you watch for while you're using it, but on the right, contraindications are the reasons you don't even start. For instance, if you already know you're allergic to any of the ingredients, just don't use it, period. And since this is an antibacterial, it's not going to do anything for fungal or viral issues like athlete's foot or a cold sore. Okay, last but not least, a quick and easy but very important point on storage. You want to make sure this dressing is still sterile and effective when you go to use it, and that means storing it correctly. The rules here are super simple. 1, keep it cool. That means below 25 degrees Celsius, which is about 77 degrees Fahrenheit. And 2, keep it in the dark. Don't leave it sitting out on a sunny windowsill. Why? Because heat and direct light can actually break down those active ingredients, making the dressing less effective. So there you have it. That's Polygras in a nutshell, a non-stick dressing with a dual antibiotic action designed for wounds where infection is a concern. Now that you know the ins and outs, what's in it, how it works, and the safety rules, the real question is, does this sound like a good fit for your first aid kit? Thanks for watching.